You feel a sharp pain in your stomach. It burns, it twists. You double over in your thatched roof house in rural England, and your wife calls for the only person who might help you, the local barber. He arrives not with a medical degree, but with a leather case full of razors, leeches, and a small bone saw. He is your doctor. And this is the year 1280. For over 1,000 years across Europe, the Middle East, and parts of Asia, getting sick meant something very different than it does today. There were no hospitals the way you picture them. No antibiotics, no anesthesia, no understanding of bacteria, viruses, or even that invisible organisms could kill you. And yet people got sick every single day, from plague, from infection, from contaminated food, from childbirth, from simple wounds that turned septic. And they needed anyone, to try to fix them. So who were these people? What did they actually do to your body? And did any of it actually work? The answers are stranger, darker, and occasionally more brilliant than you probably imagine. Start at the top of the medieval medical hierarchy. If you were wealthy, a king, a duke, a high-ranking bishop, you might have access to a university-trained physician. These were rare, extremely rare. In the year 1300, the entire city of London had roughly 12 licensed physicians for a population of around 80,000 people. That's one doctor for every 6,600 souls. Most of them trained at one of a handful of European universities, Bologna, Montpellier, Paris, or later Oxford and Salerno. And what they learned, there was not what you'd call modern science. The foundation of all university medicine was a theory that had been dominant for over 1,000 years. It came originally from ancient Greece, from a physician named Hippocrates around 400 BC, and was later expanded by a Roman doctor named Galen in the 2nd century AD. The theory was called Humoralism. It held that your body contained 4 essential fluids: blood, phlegm, yellow bile, and black bile. Each one corresponded to a temperament. Blood made you sanguine, cheerful, warm. Phlegm made you calm, sluggish, cold. Yellow bile made you choleric, angry, aggressive. Black bile made you melancholic, sad, withdrawn. Illness, according to this framework, was an imbalance among these 4 humors. You didn't get sick because a bacterium invaded your tissues. You got sick because you had too much phlegm or too little blood, or your black bile was excessive. The entire job of the medieval physician was to restore balance, and that meant one of 3 interventions: bleeding, purging, or dietary change. Bleeding was the most common treatment in all of medieval medicine. A physician or barber would open a vein, usually in your arm or your neck, and drain a measured quantity of blood from your body. Sometimes they used a small blade called a lancet. Sometimes they used leeches, those slimy black worms that attach to your skin and feed until they've consumed several times their own weight in blood. In the 12th century, the medical school at Salerno in southern Italy, one of the oldest and most respected in Europe, produced a famous text called the Regimen Sanitatis Salernitenum, a health guide that recommended seasonal bloodletting as a routine preventive measure. Not just for the sick, for everyone, twice a year at minimum. Purging was the second pillar. If bleeding removed excess blood, purging removed excess bile and phlegm. This meant emetics, substances that made you vomit. It meant laxatives, some of them violently effective. It meant sneezing powders to clear phlegm from the head. One common prescription involved drinking a mixture of vinegar and honey on an empty stomach. Another involved inhaling crushed herbs through a reed tube. The goal was always the same: expel the bad humor, restore the balance, let the body heal. Diet was the third. Medieval physicians believed profoundly that food was medicine. A patient with a hot, dry illness, a fever, an infection, a rash, was given cooling, moist foods: cucumber, lettuce, barley water. A patient with a cold, wet condition, lethargy, swelling, excess mucus, was given warming, dry foods: roasted meat, spiced wine, ginger. This wasn't random. It followed a detailed system called the non-naturals, 6 factors that every physician was trained to manage: air, food and drink, sleep and waking, motion and rest, retention and excretion, and the passions of the soul, which meant your emotions. A good physician would assess all 6 before prescribing anything. And here's what's remarkable: some of this actually helped. Not the bleeding that almost always made things worse, but the dietary advice, often reasonable, the emphasis on rest, beneficial, the attention to emotional state, ahead of its time. And the herbal pharmacopoeia that medieval physicians drew on, passed down from Galen, from the Persian polymath Ibn Sina, whose Canon of Medicine became the most widely used medical textbook in both the Islamic world and Europe for over 500 years. contained compounds that genuinely had physiological effects. Willow bark, which contains salicin, the chemical precursor to aspirin. Ergot, which in careful doses could stop bleeding after childbirth. Poppy extracts, which were one of the only effective painkillers available. These weren't placebos. They were real pharmacology, discovered through centuries of observation and trial. But university-trained physicians were the elite. They treated the rich. They charged enormous fees. And they almost never touched your body directly. Diagnosis was done by examining your urine in a glass flask, checking your pulse, and asking detailed questions about your sleep, your appetite, your emotional state, and your stool. Physical examination was considered beneath a learned physician. That was for someone further down the ladder. The barber-surgeon was that someone. In the medieval world, surgery and medicine were completely separate professions. Physicians theorized, surgeons cut, and barbers, who already had sharp blades for trimming hair and beards, often doubled as surgeons for simple procedures. They lanced boils, they pulled teeth, they set broken bones. They amputated infected limbs, usually with the patient fully conscious, biting down on a leather strap while 2 or 3 strong men held them down. The speed of a medieval barber-surgeon was legendary. The French surgeon Henry de Monville, writing in the early 14th century, described the ideal amputation as taking less than the time it took to recite a short prayer. Speed mattered because there was no way to stop the pain and no way to prevent infection. That last part deserves emphasis. Medieval doctors had absolutely no concept of infection as you understand it. They did not know that invisible living organisms contaminated wounds. The dominant theory was miasma, the belief that disease was caused by bad air, by rotting smells, by toxic vapors rising from swamps or corpses. It's why plague doctors in later centuries wore those iconic beak-shaped masks stuffed with aromatic herbs and flowers. They thought the herbs would filter the poisonous air. They had no idea they were breathing in a bacterium called Yersinia pestis, carried by fleas on the backs of rats. And yet, even without germ theory, some medieval practitioners stumbled onto practices that we now recognize as surprisingly sound. The Italian surgeon Theodoric Borgognoni, writing in the 13th century, argued forcefully against the common practice of letting wounds fester before closing them, a practice endorsed by Galen himself. Theodoric insisted that wounds should be cleaned with wine and closed immediately. He was essentially describing antiseptic technique 600 years before Joseph Lister formalized it. His reasoning was wrong. He attributed it to keeping out bad air, not bacteria, but his instinct was right. Beyond the physician and the barber-surgeon, there was a vast, chaotic world of folk healers, midwives, herbalists, monks, nuns, and outright charlatans. Monasteries were important centers of medical care throughout the Middle Ages. Monks maintained herb gardens called physic gardens, cultivating plants like chamomile, fennel, sage, and lavender. They kept infirmaries for the sick brothers and sometimes for the local poor. The Benedictine abbess Hildegard of Bingen, writing in the 12th century, produced extensive works on natural medicine, recommending everything from spelt bread for digestion to fennel compresses for eye infections. Some of her recommendations were genuinely therapeutic. Others were mystical nonsense. She was working in a world where medicine, religion, and superstition were so deeply entangled that separating them was nearly impossible. Because here's the thing you have to understand about getting sick in medieval Europe. The church was not separate from your treatment. It was central to it. Illness was widely understood as divine punishment, a consequence of sin, a test of faith, or a mysterious part of God's plan. Praying to saints was a standard medical intervention. Saint Blaise was invoked for throat ailments, Saint Apollonia for toothache, Saint Roch for plague. Pilgrimage to a healing shrine, Canterbury, Compostela, Rocamadour, was prescribed by priests and sometimes by physicians alike. The relics of saints were believed to emit a healing power. You might press a cloth touched to the bones of a saint against your wound. You might drink water that had been poured over a shrine, and if you recovered, it was the saint's intercession. If you died, it was God's will. The mentally ill occupied a particularly tragic space in this world. Conditions we would now diagnose as schizophrenia, severe depression, bipolar disorder, or epilepsy were understood as demonic possession, divine punishment, or moral failure. Treatment ranged from exorcism, which could involve physical restraint, starvation, and prayer, to confinement in chains. The monastery of St. Mary of Bethlehem in London, which eventually became the infamous Bedlam Asylum, housed the mentally ill from the 14th century onward. Conditions were brutal. Patients were often caged, beaten, and displayed to paying visitors as entertainment. What about women's medicine? In theory, female healers and midwives controlled the domain of women's health, childbirth, menstrual complaints, fertility. The Trochala, a set of medical texts attributed to the medical school at Salerno and possibly compiled by a woman named Trotta, addressed everything from difficult labor to facial beauty treatments to contraception. It recommended sitting over a steam of boiled herbs to ease childbirth. It advised women seeking to avoid pregnancy to wear the uterus of a goat around their neck during intercourse, an amulet, not medicine, but revealing of how closely the physical and the magical overlapped. As universities consolidated control over medical licensing in the 13th and 14th centuries, female practitioners were increasingly pushed to the margins, accused of witchcraft, and excluded from formal practice. So did any of this actually work? The honest answer is, occasionally yes, and mostly by accident. The herbal remedies had real pharmacological properties. The dietary advice often promoted genuine health. Clean wound care, when practiced, saved lives. But the overwhelming majority of medieval medical intervention, the bloodletting, the purging, the amputations without anesthesia, the exorcisms, either did nothing or actively made things worse. A study published in the Proceedings of the National Academy of Sciences in 2018 examined skeletal remains from medieval London and found that patients who received medical treatment for fractures actually had worse outcomes than those who healed naturally in some cases. The intervention itself was the danger. And yet, these were not stupid people. They were operating within the best framework available to them, using the tools and the understanding they had inherited. Galen's humoral theory was wrong, but it was internally consistent and survived for over a millennium because nothing better had come along to replace it. Ibn Sina's Canon of medicine was genuinely encyclopedic and remained a standard reference for centuries because its herbal and diagnostic knowledge was real, even when its theoretical underpinning was flawed. The medieval barber-surgeon who cut off your leg without washing his hands was not ignorant. He simply lived in a world before the microscope, before germ theory, before Lister and Pasteur and Semmelweis. You live in a world now where a minor infection is cured by a pill you pick up at a pharmacy for $12, where surgery happens under general anesthesia in a sterile operating room, where a doctor can image the inside of your skull without making a single incision. You take this for granted. You complain about wait times. You second-guess your physician on the internet. But every one of those modern miracles stands on 1,000 years of blood, error, trial, and suffering. Every clean hospital room exists because someone, somewhere in the medieval world, noticed that wine on a wound seemed to help. Every anesthetic exists because someone screamed through an amputation, and someone else decided there had to be a better way. Every antibiotic exists because someone died of an infection that could have been prevented, and that death haunted a researcher until the problem was solved. The next time you sit in a doctor's office, annoyed at the 15-minute wait, remember this. For 1,000 years, your ancestors sat in mud and smoke, bleeding into a bowl, swallowing whatever a barber told them to swallow, praying to a saint whose bones were locked in a stone box 3 towns away, and hoping against all evidence that it would work. And sometimes, against all odds, it did.